be gas exchange between an alveolus and a pulmonary capillary. And the question is basically, how much oxygen can you get into the blood in the pulmonary capillary, and how much CO2 can you dump? That's the question. So I will give you these two values. This is remember the partial pressure? We ended with that. That's Dalton's law. He said the whole is equal to the sum of the parts. So partial pressure from the atmosphere, this would vary if you went up in elevation, this number would go down. But here at atmospheric pressure, we're going to hang out at sea level, it's about 100 millimeters of mercury. Pulmonary capillary, the blood that's coming in, is about 40 millimeters of mercury. So you should be able to see right away in which direction is oxygen going to diffuse. From the blood to the alveolus, or from the alveolus to the blood. Things move from high to low until equilibrium is reached. So hopefully you see this is high and this is low, right? Right?
Yeah.
That's not hard. Okay, so oxygen is going to go this way. But here's going to be the exam question. So we'll set it up exactly like this and say, what will be the PO2 of the blood when it leaves the alveolus and goes back to the heart to be recirculated throughout the body? The question is, what's the PO2 now? What is it going to equilibrate with? What is equilibrium? How high can this number get?
70.
That's a great guess. That's what most people would guess. It's not right, though. There's a reason why it's not right. This is not a closed system. So imagine if you will, from a moment-to-moment basis, if you got a little molecule of oxygen and it's diffusing down its concentration gradient, right? Partial pressure is just like a concentration gradient. We just use pressure because it's a gas. So it diffuses. So in that moment, this number in the blood gets bigger, and this number right here gets smaller. And that's precisely why you guess, you'd split sort of the difference. But that's not what happens. Because in the next minute, what's going to happen? This number is going to go back up again. Because you're going to inhale again. So this number, is constantly being refreshed. This number doesn't change. So that's the number you equilibrate with. So believe it or not, you should believe it, because it'll make sense when you think about it for a minute. When the blood leaves the pulmonary capillary to go back to the heart, that number is going to be whatever the alveolus is, whatever the partial pressure is. So it's going to be 100. That's how much oxygen you can get in here. In order for this number to be higher than this, is that possible? Could this be 101 or 100.1? You would need what?
The same amount in the alveoli.
Well, that's active transport, isn't it? You need energy to do that, so we can't do that. This is just diffusion. So it's confusing because it's an open system. If you're confused, that's okay. Well, we're going to look at this 4 times, actually. It's the same thing each time. PCO2. Oxygen and CO2, they diffuse at the same time. PCO2 of the air we breathe is about 40 millimeters of mercury. Again, we're at sea level. PCO2, I should have used different colors, sorry. Oh, I do have it. Just keep it in the same color. It'll be easier to see. CO2, 40. Sorry. CO2, because we got 2 gases. If you're drawing with one pen, it won't matter. If you have 2 pens, now I've messed you up totally. Okay, the PCO2 of the blood, as it comes to the lung to be recharged, if you will, is about 46. So the question is, which way is carbon dioxide going to go? From the blood to the pulmonary capillary, from the alveolus to the pulmonary capillary, or the other way around?
Other way around.
Other way around. So oxygen goes that way. Great, now we got everybody in the right color. So CO2 is going to go from high to low until equilibrium is reached. So the exam question is going to be the same. What's going to be the PCO2 of the blood when it leaves? How low can it go? Take a wild guess.
40.
40. It's going to be as low as whatever the alveolus is. So what's happening is, from one moment to the next, molecule of CO2 diffuses from the blood to the alveolus. So this number gets lower, this number gets higher. But then you breathe again. And then you inhale atmospheric air. And then the atmospheric air is whatever it is. It's not a closed system. If we closed it, boop, if you were asphyxiating, if you were not breathing, then what Bradley and most everybody else was thinking would be true. You would split the difference. It would go to equilibrium between the two numbers. But that's obviously a crisis situation. We don't normally do that. It's constantly being recharged. So the pulmonary blood equilibrates with whatever the alveolar air is. So if I gave, by the way, these numbers change a little bit. Your book may use maybe 104, in which case this number would be 104. It is whatever the alveolus is. Good so far? The other part of the story is the diffusion between a systemic capillary and a tissue cell. And believe it or not, why did I say that now twice? Believe it or not. Same story, but for a different reason. So here's the blood coming in. Here's a little systemic capillary. Pick your favorite cell, whatever standard cell could be, liver, kidney, bone, doesn't matter. The PO2 of a normal, metabolically active, sort of middle-of-the-road kind of cell is about 40 millimeters of mercury. This blood that's coming in fresh from the heart, fresh from the lungs, it's all heavily oxygenated, has a PO2 of about 100. Which way is the oxygen going to go? Yeah, it's going to go into the cell. So we've got, I'm going to stick with blue, sorry. Why did I do that? PO2. So the oxygen's going to go from high to low. But the question is going to be, so again, on the exam, I kind of set it up exactly like this. I'll give you the cell, I give you the blood coming in. I always ask you, what's the blood coming out? So as it leaves, after equilibration, what's the number going to be? It's not intuitively obvious, but it's exactly the same as the other story.
40.
It starts at 100. It's going to go to 40.
40.
And you're wondering why. Why does it not split? So, same thing. But it's not because this is being refreshed by the atmosphere. What is this cell doing all the time? What's it using the oxygen for? Cell respiration. So as soon as oxygen diffuses in, this cell uses it for metabolism. Remember that whole citric acid cycle electron transport chain thing? So it uses it at the rate it is delivered. So one of the big things the body has to do is match capillary blood flow with metabolic rate. So as a tissue starts metabolizing more and needs more fuel, like muscles if you're exercising, it increases the blood flow. If you don't need it, you shut the blood flow down. So the blood delivery exactly matches what the cell is doing. So that means that from a moment to moment, if you're kind of taking snapshots, as oxygen diffuses in and you think, oh, this number should go up, it doesn't. It gets used up. So it basically stays at this number. Just like these numbers stay the same, for a different reason though. Think it's the same with carbon dioxide? Take a wild guess. It's the same. So the PCO2 of the blood coming in is 40. And the PCO2, keep the right color, of an active cell, reasonable metabolism is about 46. So the question is, which way is the carbon dioxide going to go? I think everybody's got this now. That's oxygen. CO2 is going to go other way, out of the cell, into the blood, that's CO2. And the question will be, what is the PCO2 going to be?
46.
How high can it go? Now we're trying to dump this stuff, it's going to go to 46. Whatever the cell is. So everybody knows that everything goes from high to low till equilibrium is reached, but this is kind of a really great example of it. It's kind of weird to wrap your head around it because you want to split the difference, but you can't. In the lungs, the blood equilibrates to whatever the alveolar air is. And in the tissue cells, the blood, when it leaves after service, it equilibrates to whatever the cells are. That's as much as you can get out of it. Otherwise, you know, if you were going to pick up any more oxygen, or dump any more CO2, I mean, you would need active transport. Can't have that. We don't have enough energy for that. It's all diffusion.